good day, fellow South Africans and citizens of the world. And yes, it just gets worse. Now the ANC government are nationalising health. You know, the health system in South Africa is a complete disgrace. I don't even have to go there. You just have to look at the old videos. What's happening in the hospitals, the public hospitals in South Africa, it's a complete and utter joke. But they're compounding it, aren't they? This is your ANC communist government. The gangster state, the most corrupt state in Africa. And that's saying something. A recently leaked version of the revised NHI Bill states that medical schemes will only be allowed to cover services not offered through the NHI, which at this point has yet to be disclosed. Treasury has voiced its concern in a letter directed towards Dr. Olive Shisana, the presidency's advisor on NHI, where it argued in favour of removing this section from the draft. The debacle has created unnecessary tension between government stakeholders who should be working towards a common cause, according to Dr. Nicholas Berger, healthcare consultant at Frost & Sullivan. The government's intention to deflate the role of private medical schemes will have major repercussions as reimbursement avenues for private practitioners and other service providers will be further constrained, said Berger. Furthermore, this prevents consumers from seeking private insurance for all services, he said. Now, I need to add here that there's a huge brain drain going on in South Africa. You know, that's not rocket science. We know that's happening. And a big part of it is qualified doctors with high skills who are the people who are basically the backbone to the health industry. Now, when you throw another dart at them, guess what's going to happen? You're going to have another exodus of people in the medical profession from South Africa. Remember Malema's claim that every single little township would have a clinic and everybody's health care would be catered for. Well, there's one little issue with that, and that is that you need qualified staff to actually man something. There are hospitals, public hospitals in South Africa right now, which don't have a doctor. Some hospitals have been closed down. You know why? Brain drain. So what are they doing here, the ANC? They're now saying to these doctors who are left in South Africa that when you treat someone, if they can't pay, tough titties, that's your problem. You still have to treat them. Now, this is just totally ludicrous, but this is where the ANC government is taking South Africa. Let's carry on with this article. Furthermore, this move prevents consumers from seeking private insurance for all services, he said. This will inevitably result in a string of legal battles between government and the private sector, further delaying progress in improving the ailing public sector and implementing the NHI, or some form of universal health coverage system. Other areas where the Department of Health has contradicted itself in relation to the previous version approved by the Minister of Finance include its desire to regulate provincial health budgets, rendering regional departments incapable of independently operating their own healthcare systems, he said. Should the NHI Bill fail to address several pain points highlighted by the general public, key opinion leaders, and private healthcare stakeholders, the nation will lose more faith in the government's promise to collaborate to offer a high-quality, comprehensive healthcare service to all South Africans. Investments into the private sector could take a dive, and the already disgruntled private healthcare workforce may be pushed closer to leaving our shores in search of a more stable work environment, said Berger. That is exactly my point. You know, one of the greatest assets that any country has, any community have, are the skills of the people who live in that community. And when you start driving out the doctors from your community so they have no choice but to go to another country, you're creating huge issues for yourself. And that is exactly what the ANC government are doing right now. They have absolutely no idea what they're doing. Berger added that the government's push to finalise the new NHI Bill and its subsequent lack of correspondence with the Treasury may be linked to its desire to garner votes in the 2019 election. Now, obviously this article is a few months old, but the information in it is right on the money. So don't worry about the age. This is the same bill we're talking about that has just been signed into law in South Africa. However, South Africa's public healthcare sector is ill-equipped to provide medical services to all 56 million South Africans, even if it is successful in securing partnerships with certain private players. According to a recent report released by the Office of Health Standards, or OHSC, 308 healthcare facilities were non-compliant, scores between 40 to 49%, and 224 facilities were critically non-compliant, scores below 40%. With the standards set forth in the compliance judgment framework representing approximately 76% of all facilities assessed by the OHSC. Basically what they're saying is the public health system has failed. And a huge part of this is BEE. What you now have is black nursing staff, not properly trained, don't know what the hell they're doing, but they get their paycheck every week and that's all they're interested in. And there's so much evidence of that, it's crazy. And of course that goes right up to the doctors as well. And if we look at other professions, even some of these magistrates who now work in South Africa are totally unqualified to do what they're doing. The whole system in South Africa is just imploding. This snapshot of the state of public health facilities in South Africa should sound the alarm bell for proponents of the NHI. The national public healthcare workforce also requires substantial reinforcements with numerous provincial departments lacking personnel, including specialists, said Berger. The regulatory framework inhibiting access to telemedicine solutions is currently under scrutiny, which may compensate for the lack of healthcare professionals and specialist physicians across South Africa, particularly in rural districts. The government is also encouraged to embrace other digital health solutions such as a comprehensive electronic health record database to address inefficiencies within the public health sector. So, I really don't have to add much more to that, but, another case of classically shooting yourself in the foot. Bring that story up to date. This is hot off the press. The National Health Insurance Bill was approved by the Cabinet on Thursday, taking South Africa a step closer to a major health policy change that could spell disaster if industry warnings are not heeded. The Department of Health said Minister Zweli Mkhize would announce more details on Friday. The National Health Insurance Bill was described by the previous Health Department as providing free, high-quality health for all. That's a load of bullshit. It's self-evident. Look what's happening in the public hospitals. High-quality healthcare, forget about free. High quality? You gotta be joking. Alright guys, please remember to subscribe to be kept informed. Ring the bell for the updates and have a great day.